Researchers have developed an experimental drug that appears to delay symptoms in some people who are genetically destined to get the disease in their 40s or 50s. It is a first of its kind study, but early results have been encouraging. However, the NIH grant that researchers hoped would fund further research to save lives has been delayed, an example of how spending cuts and confusion in Washington are affecting critical scientific research. Joining me now is Dr. Vin Gupta, global health policy expert and an MSNBC medical contributor. So, Vin, this study focuses on a particular group of people who have this rare gene mutation that almost guarantees they'll get Alzheimer's, and they get it younger than most. Let's just start with the baseline. How promising are these initial findings?
Well, Chris, they're pretty extraordinary. I would say for all your viewers out there, Alzheimer's, usually the risk factor is age, genetics, in some cases environment, family history, really big deal. But we manage it, Chris, for most patients through symptom management. They develop it and we try to control their symptoms. We can't actually cure the disease despite some recent advances. This is a big deal. For decades, we've tried to find something that can stop in its tracks the development of Alzheimer's, and that's exactly what this experimental therapy seems to be doing. It's a small study, but it took a group of high-risk individuals, genetic predisposition. They're pretty much guaranteed to develop Alzheimer's based on their family history. And what we noticed is that it delayed the onset for half of the enrolled participants by years, and really by removing the protein that accumulates in your brain that causes Alzheimer's. It was doing that really effectively.
So is there reason to believe that if you had a breakthrough for this smaller specific group, again, tied to their genetic predisposition, that it could lead to an effective treatment for the nearly 7 million Americans who have Alzheimer's? I mean, as a population, I should note, it's projected to nearly double by 2050.
Absolutely. Especially with the way our demographics are going, more and more people are getting older as a proportion of the population. So we're going to see more Alzheimer's, no question. And yes, the short answer is yes. This is the sign that we needed for the first time in decades, something that when initiated, and this is critical, early. You have to have early symptom recognition. You have to know you might be at risk. Because, Chris, here's the thing. Nobody here was symptomatic. Usually we diagnose Alzheimer's when somebody has signs of cognitive decline, memory lapses, difficulties with problem solving. So there's telltale signs. In this case, it's we think you're going to develop it. Let's start you on treatment early. So that's the critical piece here. We have to think about the patient journey differently in early initiation of therapy. If we did that, yes, we could alter the course and the burden of disease from Alzheimer's.
The AP actually profiled a 50-year-old man, Vin, who has this rare gene. His father, his brother both died of Alzheimer's around his age. And he's been on the drug for more than a decade and has shown no symptoms. And he told the AP this, quote, "This trial is life. It's still a study, but it has given me an extension to my life that I never banked on having." And he wondered how much time he would have had if the blocked funding stopped his doses, and what happens going forward if it stops his doses. How concerned are you that the uncertainty spreading through the health and science agencies right now, the research community, will have serious consequences, short and long term?
Well, this is the rub here, is that in 5 years, say medium term, I'll say what happens in 3 to 5 years when people are going to rely on these therapies. Maybe they would have gone towards commercialization, FDA approval. That's when we're going to wish the decisions today were not being made. 68 trials, Chris, on Alzheimer's are being conducted right now, or were being conducted and funded to remove that protein from people's bodies that were predisposed to this disease. 68 trials. And those are now potentially all being put on hold, maybe some canceled. If there is no incentive and government investment in high-risk, high-reward trials like these that could fundamentally reshape how we care for something as vexing as Alzheimer's, what's going to happen? We're not going to give hope to patients, but we need long-term investment. And frankly, the only actor in the world that's going to do that at the level that's required is the U.S. government.
But to be fair, Vin, hasn't every major breakthrough in science at one time or another been considered high risk?
Yes, absolutely. And what's interesting here is People sometimes miss the etiology of some of the most transformative medications that we now have at our fingertips, or we're trying to get to our fingertips. But think about the weight loss drugs, Chris. It's forgotten that the American taxpayer, through the NIH, funded the seminal research into now what is Wegovy and Ozempic 20 years ago. The time horizon here for innovation in medicine is long, but the payoff is extraordinary in many, many cases. And exactly to your point, everything that's shaping the tools in our toolkit right now, our health toolkit, took time to develop and was viewed at the time as high risk, high reward.
Dr. Vin Gupta, important stuff. You